Welcome to my channel. In the first video, I talked about long-term therapy with proton pump inhibitor and its association with vitamin B12 deficiency. First, I'd like to talk about the discovery of vitamin B12. In the mid-19th century, physicians in England had identified a type of anemia which is called pernicious anemia. It's a type of megaloblastic anemia that results in production of too few red blood cells and leads to tiredness, breathlessness, and it can be fatal. In 1926, physicians from Harvard University recognized that eating half a pound of liver, which is equal to 227 grams, would prevent this type of anemia in most patients. From this point, researchers around the world started to isolate the anemia-preventing substance from liver. Prior to this research, there were ongoing animal screening to test various diet and nutrients, but there seemed to be no suitable animal analog of this disease. And then later on, researchers from Columbia University worked together and to find patients willing to participate and feed them with this liver extract. But unfortunately, they had to wait weeks for patients because this type of anemia is rare. Later, Folkers learned that microbiologist Marie Sharp had identified a bacterium that responded to liver extract, and he recognized that this bacterium may be used as a stand-in for human subjects. The researchers recognized that liver that produced the most promising effect were pinkish in color. In 1947, Folkers and his team isolated vitamin B12, known as cobalamin, producing tiny bright red crystal of vitamins. Vitamin B12 deficiency may occur if you have certain medical conditions such as autoimmune disease and conditions that affect stomach and small intestine. Malnutrition and eating disorder are among other factors which may lead to vitamin B12 deficiency. People with a strict vegan diet for approximately 3 years may develop vitamin B12 deficiency. The reason is that vitamin B12 is stored in excess in a liver, and it takes a long time to be depleted completely. So, in the first video, I talked about how does the body absorb vitamin B12. As we already know that stomach acid is required to break down protein and to release vitamin B12. And we need another factor called intrinsic factor, which is produced by parietal cells in your stomach in order for vitamin B12 to be absorbed in small intestine. Vitamin B12 needs to be converted to its active form called methylcobalamin in order to be absorbed. And this conversion takes place through an enzyme, MTRR, methionine synthase reductase. And methylfolate is the methyl donor here. What is methylfolate? Methylfolate is the active form of vitamin B9. We all know vitamin B9 as a folic acid. Folic acid is the synthetic form of folate, and it needs to be converted to its active form in order to be absorbed. And the active form is methylfolate. Methylfolate uh, serves as a methyl donor for the conversion of cobalamin into methylcobalamin. And the methylcobalamin forms a complex with another enzyme, which is methionine synthase, to create methionine from homocysteine. Basically, a methyl will be added to homocysteine and methionine will be formed. Methionine is an essential amino acid used in the production of protein, and it's literally the starting amino acid for every protein your body makes. There are also many forms of vitamin B12. Methylcobalamin is the first form that we already know, and it is the best form to supplement and well tolerated. People who cannot tolerate methyl well do better on adenosylcobalamin. There is also hydroxycobalamin. We have also cyanocobalamin. Cyanocobalamin can be found in trace amount in food and also in supplements. Apologies, but it's generally not recommended. While methylcobalamin and adenosylcobalamin are the only form that can be enzymatic cofactor, the other forms needs to be converted into them. In some instances, taking the incorrect supplements may lead to unwanted symptoms. For this reason, discuss your medication list with your doctor and healthcare professional before starting any supplements, especially regarding vitamin B12 deficiency. The choice of administration route, such as oral supplementations or vitamin B12 injections, depends on underlying condition that led to vitamin B12 deficiency in the first place.